Okay, I want to welcome everyone to today's webinar, The Basics of Health Insurance. My name is Kiana Walton, and I'm with the Consumer Education Advocacy Unit of the Maryland Insurance Administration. Today, we will discuss different ways people can obtain health insurance, understanding your health insurance coverage, and the resources available to help you obtain the right health insurance coverage for you and your family. Health insurance terms and coverage options can be very frustrating for consumers, especially because insurance plans differ in which providers you can see and how much you have to pay. It is important to understand your costs and key health insurance terms so you'll know what services your plan will pay for and how much each visit or medicine will cost. Health insurance is a critical basis of access to quality health care. And to help us dig deeper into these important topics, we have two very knowledgeable speakers here with us today. We have Patricia Dorn, outreach staffer from the Maryland Insurance Administration. We have Patricia Barnes, community liaison from the connector entity of the Maryland Health Exchange, Healthcare Access Maryland. I just have a few housekeeping rules before we begin. This event is being recorded. This event is being recorded. Attendees will need to remain muted with cameras off. If you have a question, please put the questions in the chat box. Questions will be asked after each presentation. So when a presenter finishes, I will ask for questions. So if a question comes up while the presenter is speaking, please feel free to put the questions in the chat box. With that, I would like to introduce our first speaker, Patricia Dorn of the Maryland Insurance Administration.
Thanks so much, Kiana. And welcome, everyone. My name is Patricia Dorn. I am an outreach staffer in the Consumer Education and Advocacy Unit of the Maryland Insurance Administration. And so I am going to start this presentation today talking about understanding your health insurance part 1. And in this part, I'm going to cover what is health insurance, so defining health insurance, and then as well as I will start to talk about the different ways in which people get health insurance. So understanding your health insurance coverage, part 1. Just one second. Make sure I can move the slides. All right, so I'm going to talk about what is health insurance, the types of health insurance, ways to obtain health insurance, and what is not health insurance. So for starters, what is the Maryland Insurance Administration? Our agency, the Maryland Insurance Administration, we're the state agency that regulates insurance in Maryland. We regulate the business of insurance in Maryland. So what does that mean? That means that we license the insurers, so those that offer the insurance products, as well as the insurance producers. So the insurance producers, those are your agents and your brokers. We license them to do business in Maryland. We examine their business practices to ensure compliance, to make sure that they follow the laws. We monitor the solvency of insurers. And what we're doing there is we're making sure that the insurers that operate in Maryland, that conduct their business in Maryland, that they're going to have that money to pay your claims in the future. We review and approve the insurance policy forms, and we review insurance rates. We review these rates to make sure that they're not inadequate, so that they are collecting enough money to be able to pay your claims in the future and stay in business, but that they're also not excessive or unfairly discriminatory. And we investigate consumer and provider complaints and allegations of insurance fraud. So if you feel that your insurer or your insurance producer has acted improperly, you as a consumer, you have the right to file a complaint as well as a provider. Examples of improper action include, and I'm going to read through these examples of improper actions, but that's not to say that these are the only reasons that you can file a complaint with the Maryland Insurance Administration. But here's some examples. Improperly denying or delaying payments of all or portions of a claim. So you have a claim that's been denied, or possibly payments are being delayed to you. Improperly terminating or canceling your insurance policy. Raising your insurance premiums without proper notice, or making false statements to you in connection with the sale of insurance. So misleading you on the sale of insurance, something that you're purchasing, or during the processing of an insurance claim, and as well as overcharging you for services. So let's get started talking about health insurance. So what is health insurance? Health insurance is a contract between an individual or group and a health insurer. So it's a contract between an individual or a group and the health insurer. So health insurers include insurance companies, health maintenance organizations, commonly referred to as an HMO, and nonprofit health service plans. These insurers agree to pay part or all of the healthcare expenses for that individual when healthcare has been provided and is covered under contract. So that is known as the benefit plan. And this is true even if the cost of healthcare is more than an individual's health insurance premium payments. Health insurance is based on the law of large numbers. And what does that mean? That means health insurers collect monthly premiums. They collect the premiums from many policyholders, and then they pool that money to pay for the health care of all the policyholders. Some policyholders use very few health services, and some require expensive or extensive care. And there are many types of health insurance. And you might recognize some of these things: major medical health, the Medicare supplement, dental insurance, vision insurance, specified disease insurance, such as a cancer-only policy, fixed indemnity insurance, long-term care insurance, disability insurance, accidental death and dismemberment. Let's talk about the ways to obtain health insurance. And I'm going to start with number one on our list here, which is health insurance through your employer. So you may get your health insurance through your employer. Ask your employer about health insurance benefits and whether you're eligible to participate in their group health insurance plan. You probably already know that, but in case you don't, some employers offer this benefit to full-time employees, and others offer it to part-time employees as well. Some employers also pay a portion of their employees' health insurance premiums. So some employers may be helping you pay for those premiums. You might get your health insurance through a family member's policy. If you're married and your spouse has health insurance, you might be eligible for coverage under their policy. And if you're under the age of 26, you may be eligible under a parent's policy. If your family member's health insurance is through an employer or another entity, your family member should check with that entity to determine whether it offers coverage for spouses and children. So that's the second way you can obtain health insurance. Next is individual health insurance. So you may need to purchase an individual policy. And Paris Barnes is going to talk to us more about that after I'm done with this first part. Individual health insurance is health insurance that you can purchase for yourself or your family during the annual open enrollment period. That's usually between November 1st and December 15th each year. And you can do this by contacting the health insurer, by contacting a licensed insurance producer, and by contacting the Maryland Health Connection during the open enrollment period. Again, Paris is going to talk to you a lot more about that. The coronavirus emergency special enrollment period for Marylanders who do not currently have insurance, that is in effect now, and that runs until Sunday, August 15th. So that just means that there is an open enrollment period right now.
Those, right? But
a change in your income or life may also make you eligible for another special enrollment period. But again, Paris will talk more about that. And right now, that open enrollment period is ongoing until August 15th. Another way, number 4, short-term medical plans. This is if you need coverage for 3 months or less, you might be eligible to purchase a short-term policy. The health insurer may require you to provide information about your health history. So in this case, it is possible that you'll be underwritten. It's possible that the policy may be denied, or they may deny paying claims for pre-existing conditions. Just things to be aware of. Make sure if you're interested in a short-term medical plan, you need to really do your research and make sure that this type of policy meets your needs before you purchase. And this is a reason you can contact the Maryland Insurance Administration or visit our website for more information. Enrollment is permitted year-round for these types of plans. And there's a link here for more information. We're going to go ahead and we're going to post these slides on our webpage, and it should be there a couple days after this presentation. Medicare, that's number 5. Another way that people get health insurance is through Medicare. That's a federal health insurance program for those 65 and older and people with certain disabilities who are on Social Security disability insurance. Also people who have end-stage renal disease. Medicaid, number 6. In Maryland, it's referred to as Maryland Medical Assistance. So if you hear Maryland Medical Assistance, that means Medicaid. Depending on your household income, you may be eligible to receive Maryland Medical Assistance benefits. If so, you can qualify, you can enroll at any time. So if you qualify for Medicaid, that enrollment is ongoing. And here we have several links, places you can go to find out if you qualify and enroll, including your local Department of Social Services and your local health department and the Maryland Health Connection. Next is the Maryland Children's Health Program. So if you're pregnant and you have a newborn child, or you have a child up to age 19, you may be eligible to obtain health coverage through MCHIP, the Maryland Children's Health Program. And here are several links to get you going with that. Number 8 is going to be Cobra. I'm not going to talk too extensively about Cobra, but if you do have questions, please do not hesitate to reach out. If you're enrolled in your employer's group health plan and you lose your employment, you may be eligible to continue your existing health insurance coverage over Cobra. And a federal law that gives some employees the ability to continue health insurance coverage after leaving employment or under Maryland's continuation of coverage law. And I am going to say that if you are someone who's thinking about Cobra, you're currently eligible for Cobra right now. The new federal law, the Cobra Premium Assistance under the American Rescue Plan of 2021, that's a mouthful, that provides some premium assistance to certain individuals, and that you may qualify for premium assistance. It started April 1st, and this is going to go until September 30th. So if you are somebody who is eligible for Cobra and you want to find out more about that, please reach out to us. There's also some links for some more information about Cobra. So what is not a health insurance policy? So what sounds like a health insurance policy but isn't a health insurance policy? And also, why do I care? It works for me as health insurance. Why do I want to know that it's not classified as a health insurance policy? And that would be because if it's not, certainly if it's a legal product and you're free to purchase it or participate in the program, but you wouldn't have the backing of the Maryland Insurance Administration. in terms of regulation and in terms of a place to go to file a complaint. So what is not a health insurance policy? Well, a healthcare sharing ministry is an example. Entities that qualify as healthcare sharing ministries are not health insurance and are not required to offer the essential health benefits offered by traditional health plans. So they're not required by law to offer all the things that the traditional health plans are required to offer. The healthcare sharing ministries, we call in Maryland, they're religious publication arrangements. They are groups whose members share a common set of ethical or religious beliefs, and they agree to share healthcare expenses among their members. Members of healthcare sharing ministries agree to make contributions to help pay all or some portions of the eligible healthcare expenses of fellow members. The members are not guaranteed that any part of their healthcare expenses will be paid by fellow members, and members are responsible for all expenses related to their healthcare. And we just want to say, this might make sense to you, but before joining, read the description of the program carefully and make sure that you understand the guidelines and the limitations of the program. And just remember, it's not a health insurance policy and it's not backed by the regulation of the Maryland Insurance Administration. Another example of something that sounds like health insurance, but is not a health insurance policy, and those are discount medical plans and discount drug plans. So these discount medical plans and discount drug plans are not health insurance and do not pay any of your healthcare costs. Instead, discount plans offer savings to plan members on various healthcare goods and services. Those can include discounts on prescription drugs, doctor's visits, eyeglasses, vision care, dental services, lab tests. The discounts are made available through arrangements between the healthcare providers and the organization offering the discount plan. And that is part one. That wraps up part one for me. Thanks so much.
Thank you, Patty. Appreciate it. So I'm going to pause right here for a second. If there's any questions that anyone has for Patty for part one, the basics of health insurance. You can put them in the chat if you have a question. I know someone had a question in reference to the slides. Usually after the presentation, in a few days, they will be on our website. So www.insurance.maryland.gov, or you can email me. I put my email address in the chat box, and I will be happy to send you a copy. So if there's no more questions or no questions at all, we will move on to Paris Barnes, who's a part of Healthcare Access Maryland. You're on mute, Paris.
Thank you so much for having me. My name is Paris Barnes, and I'm the Community Liaison for Healthcare Access Maryland. You'll notice here's our website, as well as our phone number, and you're gonna see it a couple times through the presentation. So if you didn't snatch it from the first screen, don't worry, you're gonna see it quite a few times. So today we're gonna talk about what the Maryland Health Connection is. We're gonna talk about some health insurance options that are offered through the Maryland Health Connection. We're going to go over some more information about open enrollment, as well as a special enrollment period. And then this is a big one. We're going to talk a little bit about filing your taxes and kind of what it means to take a plan from the Maryland Health Connection. But before we do that, I kind of want to go over exactly what plans are offered on the Maryland Health Connection, so you get a bit more of an understanding of what you're kind of dealing with. So the Maryland Health Connection is the state's official health insurance marketplace where you can apply for Medicaid, which is a free state of Maryland insurance product, or it could be low cost for children, or a private health plan. These are health plans that typically require monthly premium payments. We're going to go into a bit more detail in a few slides about what that means. The Maryland Health Connection offers quality health and dental insurance that should meet your family's budgets and needs, and it is the only place where you can qualify for financial help. And again, I'm going to go over exactly what financial help means because this is a big deal that it's offered through the Maryland Health Connection. The Maryland Health Connection website can be accessed through a tablet, your desktop, or your mobile device. If you decide you want to enroll the app, you just go to your mobile app store and look for the Enroll MHC app. The application is completely compatible and it mirrors the application through the computer. All right, so just like mentioned before, the open enrollment period for health insurance is November 1st through December 15th. This means that all individuals that have private health coverage must renew their plan at this time for the next year. And if for some reason you are not covered at this time, this is the time to go ahead and try to look at your plan options and apply and enroll through the Maryland Health Connection. So here are some health insurance options that are offered through the Maryland Health Connection. So Medicaid. Medicaid and the Children's Health Insurance Program provide free or low-cost health coverage. This would include some low-income people, families, children, pregnant women, and other individuals with disabilities. And just like mentioned before, you can apply for this program at any time. And the latter, the additional option is private health plans. These are health plans that are certified by the Maryland Health Connection that provide essential health benefits. They follow established limits on cost sharing, such as deductibles, co-payments, and out-of-pocket maximums. So what this means is that plans that are offered through the Maryland Health Connection are going to offer you additional savings inside the plan. So if you have a plan that perhaps has maybe a $1,000 deductible, the Maryland Health Connection is the only place that you can come to that can assist you with eliminating or reducing that deductible. And what that is called is a cost sharing reduction. And then just understand that all plans that are offered through the Maryland Health Connection offer coverage known as minimum essential health coverage. These are things such as doctor's visits, hospitalization, mental health, behavioral health, substance use disorders, prescriptions, all those things that you know that you would need for your health. The health plans through the Maryland Health Connection are certified to offer all of those benefits. So you won't be skimped out on a benefit. You don't have to worry about if you purchase a plan this way, would you not receive a specific service? You will. So private health plans offer something called advanced premium tax credits. And I have an example of what this looks like in a few slides. But advanced premium tax credits lower the cost of the health insurance monthly premium. So this is the amount that you can pay based on your household size and income. So for example, if you have a household of 4 and you have a specific income and perhaps your tax credit is $200 and the price of the health insurance plan is $250, the family would be expected to pay the $50 because the advanced premium tax credit covered the majority of the cost. So again, I have an example in just a few slides that will kind of show you exactly what that looks like. And then your cost sharing reduction is what lowers the cost of the items inside of the plan. So this reduces your deductibles, your co-payments, your co-insurance, and sometimes your out-of-pocket maximums. So certain plans may not have a copay or may not have a deductible, which is an extremely attractive thing because that means you don't have to be able to pay a certain amount of monies before you can see a doctor. So this is a picture of the Maryland Medicaid income limits chart. The way you read the chart is on the left, you're going to select your household size. And then if you're pregnant, you're going to go ahead and skip down to line 2. And the reason being is because we're counting you as well as the unborn baby in the belly. So you're going to count your household size on the left, and then you're going to slide over to the right to look at the monthly income before tax. If your monthly income before tax is lower than the income limits here, you'd be able to qualify for Medicaid. If not, you're going to keep sliding down the list to see which income bracket you fall in. If for some reason you fall outside of the income brackets, that's okay. It just means you qualify to purchase a plan and that Medicaid is not the best option for you. Okay, and here's a brief video of how the subsidy works. That way you can kind of see it in real time. Hopefully it works for me. Okay, so it doesn't have audio, so I'm going to talk you through it. All right, so in the anonymous browsing tool, a consumer would type in their zip code as well as their county, and then the plan year would obviously be this year. You're going to enter your family's information, so basic information such as their age, and then you want to be sure to put in your dependents. So if it's a family of 4, it would be mom and spouse, and then however many children you need to add. You're going to scroll down and you're going to put your annual projected income. This is just an estimate based on what you believe your family will make. Once you do that, the system is going to give you an idea of how much money you'll be spending for health insurance with your tax credit. So in this case, the family had about $260 in tax credit. Right. Now, once you get here, you're going to see your health plans with the tax credit already deducted. So as you can see at the top bar, there's a tax credit listed. And then if you look over, the price of the plan is $74.44. This means that in all actuality, the price of the plan is much more than that, but the tax credit itself assisted with reducing the cost of the plan. This is a feature that is only offered if you purchase a plan through the Maryland Health Connection, and it's the only way you can get it through the state. So this is a very attractive feature. And again, this is based on your household size and your income situation. So here's a little bit more information about filing your taxes. So if you are someone who does not file tax returns, then you may not be eligible to take tax credits. So in order to take advantage of the cost savings that come along with your health insurance plans through Maryland Health Connection, you do have to be a tax filer. We do understand that there are some individuals who don't necessarily qualify to file taxes because maybe they're on disability or something of the sort, or maybe they don't have income, and that's okay. You still file your taxes, but you file your taxes with the intent of reconciling your tax credit. So it doesn't mean you're filing your taxes for a return. It doesn't mean that at all. It just means you're filing your taxes with the intent of receiving a tax credit. If the household or income information that the Maryland Health Connection application has is different than what's on your tax return, you may have to pay some of the costs back, or sometimes you receive a refund. So what that means is just be sure to inform myself or the Maryland Health Connection when the application information changes. If your income increases or decreases, you come back to the application and tell us, because we want to make sure that you're paying a fair price for your health insurance and that you're not paying more than what you're expected to pay. And then one more stipulation is if you are married and you wish to file or get a family plan through the Maryland Health Connection, you must file your taxes as married filing jointly to receive that tax credit. Okay, now we're going to go over a little bit about special enrollment periods. This is going to be times where you can apply for plans outside of the Maryland Health Connection. So a special enrollment period is a time outside of the open enrollment, which is November 1st through December 15th, where you can qualify for a plan through a life event. So depending on your circumstance, you have 60 days before or 60 days following an event to enroll in the plan. If you miss your special enrollment period, or if there's not a special enrollment period going on at that moment, you may not be able to apply until the next year. And if you enroll through the Maryland Children's Health Insurance Program or Medicaid, you can enroll year-round. There is no open enrollment period for that. Special enrollment periods consist of getting married or divorced, if you become pregnant, have a child, adopt or place a child for adoption, if your income changes, if you move to the state of Maryland, or in some cases to a different county, if you have a change in disability status, if you gain or lose a dependent. And what that means is gaining a dependent on your tax return or one aging off. So gain or lose a dependent on your taxes. certain changes or losses in your health insurance, if your income makes you ineligible for Medicaid or MCHIP, if you're one of those age offers where you turn 26 and you age off your parents' plan, or if your Cobra period ends. Some other special enrollment periods are if your tax filing status changes, if your citizenship or immigration status changes, this would open a special enrollment period for you. If you've recently been released from incarceration, or if you have a change in status, an American Indian or Alaskan Native. So right now is one of the most unique times ever, because if you don't have health insurance, now is the time to get it. So we're not asking individuals to wait until the open enrollment period. Individuals can enroll between now and August 15th. So it's a special enrollment period. And at the end of the application, you're going to check a box that says you are applying for the coronavirus emergency special enrollment period. And this will allow you to plan shop for plans. And the last interesting thing we're going to talk about is the American Rescue Plan. You may hear me shorten it as ARPA throughout the presentation, but this was briefly mentioned before, but this is extremely important information to you. So ARPA is a new law that offers financial help for individuals and families who qualify for private health plans. It also provides private health insurance to people who lost their job, and it pays 100% of Cobra premiums for laid off workers. Cobra premiums are eligible to be paid through September 30th, 2021. So this means if you were laid off through your job and your employer offered you Cobra, it is a good chance that your insurance at this moment may be free. So what this means for you as a consumer is if you're uninsured, you want to come to Maryland Health Connection at this time to check out your health insurance options. Maybe you looked before and the prices were more expensive than they are now. Come back and take a look and see if there's a little bit better options for you and your family. If you already have health insurance through the Maryland Health Connection, it is a good chance that your plan has already been adjusted to properly affect the new legislation. But if it has not, you still want to come to us so we can take a look and see what's going on and make sure everything looks the way it's supposed to look. And then here's some examples of some of the deep cost savings that are going on right now. So if you're 27 and you're a Marylander and you're making about $25,000 a year, you could get $250 in cost savings to apply towards your monthly premium. So this would mean your plan could be $1 or very close to it. Same thing. So this is a 40-year-old Marylander making about $25,000 a year, and they would receive about $300 in cost savings. This means the price of their plan could be about $1 or close to it as well. So you can see here that the income changes based on the person's age, but they're still taking into consideration the income bracket for the American Rescue Plan. So if you don't have insurance, you want to come and look to see what your cost savings look like right now. So to apply, you can apply for Medicaid at any time you like. If you are eligible for a private health plan, you can apply during open enrollment or right now because there is a special enrollment period. To apply, you just need a valid ID. You would need the social security number for yourself as well as the individuals in your household. We need the birthdays, any income information, and any immigration information that you may have for yourself. So this could include green cards, work permit, visas, passports, any immigration information you have for yourself. If you currently have health insurance information, we would like that as well. And the reason why is because we're going to help you cost compare to make sure that you're getting the best cost and value for what you need. And then while our offices are still currently closed, we do offer virtual support. So if you give us a call, a navigator will be able to assist you over the phone and provide you one-on-one support with enrolling. Or if you would prefer, we can do a Zoom meeting just like this, where we can kind of meet you quote unquote face-to-face and complete your application that way. We find that that is a much easier method, especially for individuals who have quite a few documents or kind of want to look at the screen as we go along with doing the application. So to enroll, you're going to give us a call at 410-500-4710. And if you give us a call, we'll be able to assist you with completing your application as well as getting some scheduled appointments for you so we can see what we can do to help you out. And then the last part, so the Maryland Health Connection is not necessarily equipped to help individuals who are Medicare recipients. And that is simply because Medicare is already a primary insurance company. You wouldn't need us. So if you need help with Medicare, the best option is to reach out to your local SHIP office. They are going to be able to assist you with coverage details, changes, out-of-pocket costs, questions about who pays, supplements, your rights, fraud, just about anything that goes across the Medicare gambit. But to do that, you want to call the office that corresponds to your county. So if you're in Allegheny County, you want to call the SHIP office for Allegheny County to receive help. And that is all. I thank you so much for your time. I do see some questions in the chat and I'm going to answer for you before we go back on to the next presenters. Okay. So the question was, please share with everyone regarding green card holders with or without children that pay taxes living in the US 5 years. Okay, so to apply for coverage, if you have a green card, what this means is you want to apply through the Maryland Health Connection, of course, and the application system itself will be able to tell you what you're eligible for. So there are some classifications of individuals who don't necessarily have to meet the 5-year bar to qualify for Medicaid, and then there's some that do. So when you apply to the system is unique and it is smart enough to determine you properly for exactly the program that you're supposed to have based on your green card status. So truly the best way to know what you or your family members are qualified for is to actually apply to the system and let the system kind of do its job, and it will tell you exactly what you're supposed to get. And then another person asked, if I have employer coverage, am I eligible to use the Maryland Health Connection? And the answer is maybe. To apply through the Maryland Health Connection, your employer has to be able to not offer you health coverage, or it must be deemed unaffordable. So when you do the application, before we make sure that we ask for current health insurance information, we will plug that information into the system, and the system does its checks and balances to see if perhaps the Maryland Health Connection can offer you a better option. So the system's smart enough to be able to figure out if your employer is a cheaper option or if Maryland Health Connection is. So the rule is it can't be over a certain amount of your income. So as long as it falls within your income bracket, then you would be able to utilize the Maryland Health Connection. If not, then you would go through your employer. But either way, the system is unique in its design that it can answer those questions for you. Okay, someone mentioned if they're out of work and they're looking for health insurance. If you're out of work, now is the time to apply because you technically qualify for a special enrollment period due to your loss of income. So you definitely want to apply, take a look at the application process with one of us, and we'll sit down and walk you through the app to make sure that you're getting the coverage that you're supposed to have. The individual said they applied. Okay, so if you have applied and you still are unsure about what you have, if you give us a call at 410-500-4710, someone can kind of look at it a little bit closer to make sure everything is okay and to make sure your coverage is going to start effectively at the right time. And they'll make sure everything went the way it was supposed to look. If something happened or if it didn't work out for you, then we can be able to fix it for you. See, someone asked, why is it good to have a broker? Having a broker is excellent for the consumer who we like to call a high involvement shopper. This is someone who has very specific health insurance needs and very specific wants from their health insurance plan. Brokers are well-versed in all of the avenues inside of the plan. So they're going to be able to sit down and dissect with you the cost of a specific service or the cost of a copay for something, or the out-of-pocket maximum that you may need. So brokers are an excellent resource to use when you're about to purchase a health plan and you really have some very specific questions about a specific health plan or a provider. Brokers are very well trained in how to use a system. They are extremely helpful in health insurance regulations. We work with brokers hand in hand when determining eligibility, and brokers do an excellent job with explaining all the plans and benefits to consumers who wish to use brokers. So I highly recommend brokers. I highly recommend consumer assistance workers. I highly recommend navigators. we highly recommend you get the help from any avenue that you can. Right.
All right. Thank you, Paris.
Thank
That was
you.
great. Good information, especially explaining the exchange and how it works and the plans that are being offered. If again, her contact information is on the screen if you would like to reach Paris to get more information. So we're going to go back to Patricia so she can do her part 2.
Thanks, Kiana. And thanks, Paris. All right, so I am on to my second part. And I am going to talk to you about understanding health insurance terms. So understanding health insurance terms. In order to fully understand the cost of your health insurance, it's important that you know the different costs for which you may be responsible and the terms used to describe it. So it is important, and there are terms in your health insurance policy that maybe you don't know, and it is hard to get a handle on the whole thing. And so I'm going to talk to you about some of the important terms to know. So I'm going to start with out-of-pocket costs. What out-of-pocket costs will I have to pay when I need services? So the out-of-pocket costs, those are going to be the costs that come out of your pocket that you're paying. Depending on your insurance policy, your insurer may pay most of the costs of your care. But you're responsible for premiums and out-of-pocket costs, such as copays, deductibles, and coinsurance, all words that I'm going to define now. So what is the premium that I would pay for this policy? So premium. The premium is the amount you'll have to pay for coverage, and that is often monthly. So it doesn't have to be monthly. Theoretically, you could pay your entire premium in a year, or it could be paid in a different way. But for most people, a premium for health insurance is paid monthly, and you need to pay that premium each month or you'll lose coverage. So what is the deductible? The deductible is the amount that you pay before your insurance company starts paying its share of the costs. So for example, if your policy has a $500 deductible, the first $500 of your healthcare expenses at the beginning of the year or whenever your policy renews, starts over essentially, that first $500 in my example is on you. And then once you have spent essentially $500, then the insurer starts paying its share of the costs. Most policies with lower premiums have higher deductibles. So a lot of times that really low premium or that really low monthly premium that you're paying to the insurer comes with a higher deductible. You will pay the full cost of most services until you meet your deductible. So again, you're possibly paying that first, say $500 in my example, until you meet that deductible. You're potentially paying the full cost of most services, not necessarily all services. And again, if you have questions, go ahead and please put them in the chat, and Kiana will address them when we're done. So what is a copay? So let's go on to defining copay. This is a set dollar amount that you must pay for a particular service. The amount may be different based on the type of service and whether the service is provided by an in-network or out-of-network provider. So when I say a set dollar amount means something like $25 or $30, a set amount. And then it might be different, say if you are visiting your primary doctor and you have a specialist, you may have a different copay to visit a primary physician It may be different than the one to see the specialist. So maybe the primary is 25 and the specialist is 50. It also might be different whether the service is provided in network and out of network, which we'll talk about a little bit more in a minute. So for example, your plan may require a $20 copay for an office visit to an in-network provider and a $40 copay for an office visit for an out-of-network provider. This fee may be in addition to any deductible, which you are responsible for under the plan. So coinsurance. So there's copay, that's a set amount. What is coinsurance? Coinsurance is your share of the costs of a covered health care service. Coinsurance, very similar to copay. So with copay, you see a set dollar amount. But with coinsurance, you're going to see it listed as a percentage. The coinsurance is applied after any deductible is satisfied, and your share is a percentage. So such as 20% of the allowable amount for a service. And there's an example listed on the slide. Let's say that you get an x-ray that costs $200. The insurance company has an allowable amount of $150. So the insurance company is going to pay $150. Your coinsurance is 20%. So your insurance company has an allowable amount of $150. Your 20% coinsurance is going to be 20% of that $150. So assuming your deductible has already been satisfied, you pay 20% of $150, which is $30. And then the insurer is going to pay the remaining $120. In-network providers and out-of-network providers. So I'm just going to expand a little bit on what that means. Your in-network providers are the providers that have a contract with your insurer. So they have a contract with your insurer. If you receive covered services from an in-network provider, generally you'll only need to pay your deductible and any applicable copay or coinsurance. You may not be billed for the balance by the provider. But out-of-network providers, these are providers that do not have a contract with your insurer. So they do not have a contract. If you receive covered services from these out-of-network providers who don't have a contract with your insurer, the insurer may not be required to pay any portion of the charges, or your copay or coinsurance may be larger than if the services had been provided by an in-network provider. So that is just something to be aware of. Be aware of who's in your network and who's out of your network. And when you see a new provider, you need to be aware if they're in network or out of network, because that can really affect how much you're paying out of your own pocket for those services. Out-of-pocket maximum. So your policy is likely to have an out-of-pocket maximum. So this means that that's the maximum amount that you pay before your insurer starts to pay 100% of the allowable amount for your covered services. So depending upon the terms of your policy or plan, this amount can include deductibles as well as copays and coinsurance. And so this is going to be listed. It could be, say, $5,000. You could have a $5,000 out-of-pocket maximum, which means that based on the policy language, when you get to that $5,000 that you've paid out of your pocket, your insurer is going to start picking up the rest for the remainder of your term. So for the remainder of that year or so with your policy. Preventive services. So what is preventive services? You do not need to meet your deductible before you receive preventive services from an in-network provider. And so when we spoke about deductibles, we said for the most part, you need to meet your deductible before services are covered by your insurer, but not for these certain preventive services. So with certain preventive services, you do not need to meet your deductible before you receive those services from an in-network provider. You also do not have to pay co-payment or co-insurance for these preventive services you receive from an in-network provider. So just remember, it's important, it's in-network. Preventive services include screenings and immunizations, as well as other services. For a complete listing of these preventive services that are covered without cost to you, please check with your insurer. Usually, preventive services do not include diagnosis or follow-up visits and services for problems. If you visit your healthcare provider and discuss the health problem, you may be charged your deductible, co-insurance, or copay. So just know that it's a possibility. If you're seeing the doctor for one preventive service, but then you're addressing another issue, there may still be a charge. Even if the initial purpose of the visit was preventive. So that's just an FYI. So after the health insurer has processed your claim, it will issue an explanation of benefits. So you're going to get an explanation of benefits, often just referred to as an EOB. The EOB, this provides details about a health insurance claim, such as what portion was paid to the healthcare provider, so the person that you saw for your healthcare, and what portion of the payment, if any, is your responsibility. This is important. This is why it's highlighted. The EOB is not a bill. Any portion of the claim not covered by the health insurer, such as the deductible, co-payment, or co-insurance, it may be billed by the provider and it should be paid directly to the provider. So remember that your EOB is not a bill. Allowable amount. Allowable amount is the maximum amount the insurer will use when deciding what to pay for a covered healthcare service. This is sometimes referred to as payment allowance or negotiated rate. You may have to pay the difference if your provider charges more than the allowable amount. And so the allowable amount is the amount that the insurer will use when deciding the maximum amount when deciding what to pay for that covered healthcare service. Balance billing. If you receive covered services from an out-of-network provider, not an in-network provider, and the cost of these services is more than the allowable amount, the provider may be permitted to bill you for the difference. So this out-of-network provider may be permitted to bill you the difference. In some circumstances, you may be protected from balance billing. For example, if you're treated by a Maryland doctor in an emergency room, the law may protect you. If you have a choice of providers and you choose an out-of-network provider, you may have to pay the full amount of the provider's bill. And so again, this is just a warning. If you're seeking to get services from an out-of-network provider, just make sure that you understand your own financial responsibilities. So if you have questions, we do encourage you to call your health insurer. If you owe money, ask the health insurer if this payment will be put toward your out-of-pocket maximum or deductible. You may need clarification on charges for certain services you received. You can ask the healthcare provider to explain these charges and services. And if you think you've been charged in error, ask your healthcare provider to go over the EOB, potentially line by line. You take the time to have them go over it so you understand it. So ask your healthcare provider to go over that with you, possibly line by line, to see if a mistake has occurred. If your insurer denies your claim for services or supplies, so after a claim is submitted to your health insurer, you receive that EOB, notifying you of its decision, potentially not to pay for some or all services. So if this is based on a lack of coverage under your health plan, it's called a coverage decision. So this isn't something that's covered under your health plan. That is a coverage decision. If it's based on lack of medical necessity, and that means someone believes it's not necessary, this is called an adverse decision. If you want to ask your health insurer to reconsider its coverage or adverse decision, first follow the directions in your EOB to file an appeal or a grievance. And you may wish to ask your treating healthcare provider to help you with this process. They can help you with this process, or you can certainly do it on your own behalf. Once you file an appeal or a grievance with your health insurer, the original decision will be reviewed by the health insurer. If it was an adverse decision, the health insurer will have it reviewed by an independent medical expert who will decide if the healthcare service or the supply is medically necessary or not experimental. If the health insurer's decision is to uphold its original decision, it must put its reason in writing. You may then file a complaint with the Maryland Insurance Administration. If the health insurer denies your claim as not medically necessary or experimental, so not medically necessary or experimental, the Maryland Insurance Administration will send your case to an independent medical expert. Just know that there are time limits for filing a complaint with us. Here I have a couple slides with a little bit of information about COVID-19. I'm not going to read this all through, but all of this information is available on our website as well. So how the MIA can help. You can file a complaint directly with the MIA before receiving the health insurance appeal or grievance decision. So I went through that process, but you can file a complaint directly with us if, under these circumstances, if the health insurer waives its requirement for you to appeal to them first. You can come directly to us. If the health insurer does not follow any part of its own internal appeal process, for example, if you don't hear back from them in the time that they're supposed to take to respond, you can come directly to us. If there is a compelling reason, such as showing delay could result in your death, serious impairment to a bodily function, serious dysfunction of a bodily organ, could cause you to be a threat to yourself or others, or could cause you to continue to experience severe withdrawal symptoms. Those are all reasons that you can go ahead and skip that appeals process internally and come straight to the Maryland Insurance Administration with your insurer complaint, your health insurer complaint. So the Life and Health Unit of the MIA investigates whether a service or supply is covered under your health plan. So the Life and Health Unit is our unit that decides, okay, this service is covered or was not covered under your health plan. For grievances, the same unit would send this matter to the Independent Review Organization, an IRO, as I mentioned earlier, to determine if the service or supply was medically necessary and or not experimental. At that point, if the health insurer is found to be wrong by us, the Maryland Insurance Administration, and the insurer still will not reverse its decision, the MIA can take action against the health insurer. So just know that you have us, the Maryland Insurance Administration, if you do have a complaint against your health insurer. This is some contact information as well, our contact information for the Maryland Insurance Administration, as well as the Office of the Attorney General. Their Health Education and Advocacy Unit, in some cases, can help you with this internal appeals process. And these slides and all this contact information will be posted online. Some publications that we have available on our website. We have a lot of publications about health insurance, a consumer guide to health-related resources, We have a consumer guide to understanding your health insurance coverage for mental health and substance use disorders, as well as understanding your rights when your health insurer will not pay for your healthcare services. We have a consumer guide to understanding your costs, kind of what I went through, where it talks about a lot of the definitions, a health insurance shopping tool to help you choose if you have multiple insurers that you're looking at, a glossary of health insurance and medical terms. We have frequently asked questions about in-network and out-of-network. So if you kind of grasp it now, but when it comes down to deciding, do I want to go in-network or out-of-network in this situation, we do have more information for you online. And we have frequently asked questions to help you understand our health insurance coverage and the claims process if you wanted to read more about that. And that is all I had for now. I'll hand it back over to Kiana and answer any questions you might have.
Thank you, Patty. So if you have any questions, you can put them in the chat, and it could be for Patty or Paris. Paris is still available to address any other questions you may have. Again, this is very important information, especially if you're trying to get the most out of your insurance plan. It's always best to know what kind of coverage you have and how much coverage you actually have. Also, shopping for the best plans for yourself, as Paris was trying to explain, it's always a good thing. And knowing your household size, because Paris, I had a question for you. If someone in your household has health insurance coverage and you do not have health insurance coverage, are you looking at the whole household itself in order for you to qualify for a plan?
Yes, so we are looking for the whole household itself because we're looking at the household income. So we're not necessarily looking, so if one person doesn't have it, that one person should certainly apply. But yes, we would look at the entire household's income situation to determine what you're eligible for.
Okay, thank you. And someone asked, how are insurance brokers compensated? And how do they check their credentials?
I'm not sure exactly how they're compensated. I know that they are, but I'm not sure exactly like as far as a percentage or where the monies comes from. I'm not 100% sure about that. But as far as the credentials are stated, the Maryland Health Connection offers a list of certified brokers that they have made sure have passed the test, that they have been certified, that they have done everything that they need to do to be able to assist you. And the broker list is very, very long, and there's brokers everywhere. So there's no reason why you shouldn't find one. But the best way to find brokers that actually have credentials that are safe to use is directly through the Maryland Health Connection. They're wonderful.
And someone put that they're compensated by the carrier.
Okay.
So a family covered by New York Medicaid, how can they be covered under Maryland Medicaid since the family has moved from New York to Maryland?
That's an excellent question. So the first thing you want to do is to make sure that the family has permanently moved to Maryland, meaning they have no intention on going back to New York. If that is the case, you would cancel your New York coverage and simply apply in Maryland. But I do want to be honest and fair with you. Every state has different Medicaid rules. So there have been situations where individuals may have been qualified for Medicaid in one state and may not qualify in Maryland. But either way, the system is equipped to be able to offer that family coverage. So nobody should be going uncovered unless there's a different situation going on. You should still be offered something.
And then the subsidies still come into play, right, Paris,
Yes,
where they may
that's
be qualified
correct.
for.
That's correct.
All right. So we still have time for any more questions that someone may have. This is the right time to ask those questions now, because once you try to get on the health exchange and trying to talk to someone, you'd have to, especially when open enrollment starts again, right, Paris? It may be very difficult. So this is the perfect time to get those questions in.
Yes, and I see Beth put on there, thank you, Beth, that like we mentioned, they are licensed through the Maryland Health Connection. So they go through rigorous training just like anyone else that is able to do an application through the Maryland Health Connection. And their training is very unique. They use a producer portal, and again, they're excellent. And you can rest assured that if you use a broker through the Maryland Health Connection, you're going to be handled with care.
All right, as I don't see any more questions, I'm going to wrap things up. So I want to thank you, Paris, for joining us, as well as Patty. You both did a terrific job of explaining health insurance. I know it can be very complicated with all the different language and the terms that you need to know. So thank you again to the both of you. I also want to let the people who have attended today to know about upcoming and future events that we will be having at the Maryland Insurance Administration. So June 15th from 11 a.m. to 12:30 for Elder Abuse Awareness Day, we will have a discussion where we will talk about fraud and scams. Also, June 23rd from 1 to 2, we will have a webinar that will talk about condo insurance and ways to resolve condominium disputes. As well as June 28th from 1 to 4, we will have our monthly listening session. And the topic will be financial security, life and disability, insurance issues for the LGBTQ plus community. So again, thank you everyone for joining us. Thanks again to our great presenters we had. And please visit our website for any additional information, as well as Healthcare Access Maryland if you have any additional information about what they offer through the exchange. Again, thank you to the both of you, and thank you everybody for joining us today.